Hello, Mrs. Woodwick. My name is Keela. I'll be your student nurse practitioner today. I want to talk to you about a medication called Remeron. The brand name is Mirtazapine. Remeron is a medication that's used to treat depression. However, it can help with other things that we'll talk about. It helps balance chemicals in your brain that affects mood, sleep, and appetite. I explained to you how it works in your body, what to expect, possible side effects, and special things to watch because of your age. If anything sounds unclear, please stop me at any time, okay? All right, great. Mirtazapine helps improve mood by increasing levels of serotonin and release norepinephrine in your brain. Serotonin is what we call the happy neurotransmitter, and it plays a role in your mood, your appetite, your digestion, and sleep. It'll help you feel calm and happy. The norepinephrine helps with energy and focus. It can also block signals that cause stress and trouble sleeping. So how your body handles Remeron is it absorbs through your stomach, it travels through your blood, and then it travels to your brain, this neurotransmitter, and then it breaks down in the liver. But however, it breaks down slowly in the liver, okay? That's why we're going to start you off at a low dose. And then your body will get rid of it through your urine. I'm going to start you off again, as I said, on a low dose, so we can see how your body is going to respond to it, see if your symptoms improve. Because as you age, as we all age, medications just process different. It takes a little longer. It takes a little longer for a medication to process, so it's a slower process, okay? Potential adverse reactions that you may experience is feeling tired or sleepy. That's why we recommend that you take it at night. Gaining weight or feeling more hungry, having dry mouth or constipation, dizziness, especially when standing. Rarely, but it has been reported, confusion or unusual thoughts, okay, or like thoughts of wanting to harm yourself. Those are rare, but we want you to be aware that it has happened to others. So as we age, our bodies change, right? I remember when I was pursuing my first nursing degree, my instructor taught us as our body ages, everything slows down and dries up. Here's what to keep in mind. You may be more sensitive to side effects like sleepiness and dizziness. So how you'll take the medication is you just put it under your tongue and it'll dissolve, and you take it at night. We're going to check your kidney and liver function in about 2 weeks just to make sure none of your levels are off and that the medication is working well with your body. I want you to let us know if you're feeling too sleepy or dizzy, or if you're experiencing any symptoms that you were not experiencing before you started the medication, okay? An important thing also to remember is from a sitting to standing position, I want you to rise slowly because the medication can potentially cause you to be dizzy. If you get up too suddenly, you may lose your balance and get dizzy. So we want you to rise slowly, okay? Just take your time. I want you to keep your appointment in 2 weeks and then come back so we can check and make sure your symptoms are improving. We can check on your labs and make sure you're feeling okay, okay? If you happen to experience any of these symptoms that I just discussed, please do not start taking the medication abruptly. Give us a call as soon as you can, and we will give you further instructions on, how to proceed further. Okay? Do you have any questions? All right, great. We'll get started.